Artificial intelligence.
Hey, hello everybody. This is Alex again from the AI Executive Podcast. I'm very, very happy to have with me today Dr. Adar, CIO of ConsensioHealth, and one of the most amazing AI executives I ever met, with lots of experience both in medical, business, and programming. And this is a very rare combination for a person to be able to be executing both in medical programming and executive capacity. So welcome to the webinar. Thanks so much for the time, Eric. Could you please introduce yourself to our audience?
So thank you, Alex, for inviting me for this interview, and thank you for the introduction. I guess you want to know a little bit about myself. I actually grew up in Israel, immigrated to the States when I was a teenager. Got my interest in computers in the early 80s. There was a little computer that came out from Britain, Sinclair Zoom and Spectrum, and I like playing around with that. Later, as I got a bit older, I lost interest a bit. I thought that what's going to interest me in life is being able to work with people. I thought that's the component that's going to keep things interesting for me. So I used my interest in science and went into medicine. And later on, there was a need in my company for more analytics, more rigorous approach to analysis of data for physician executives. And several years ago, that's how I got involved in this field.
Sounds awesome, like a super exciting trip. And this is a common characteristic among all the AI executives, that it didn't start like I need to do AI. It started actually out of a need to develop a tool or a process or something that my customers needed. Yep.
I think I agree. I know there are a lot of hobbyists there who get into the AI for the sake of getting into AI because they find it interesting. They find the concept of it interesting, or they've seen other solutions on demonstrations or YouTubes and they want to play around with it. But it's probably the case that most of the things out there that are working in business and are producing results for shareholders and for executives are probably born out of a need for results, not a need for hobbying.
That sounds so awesome. So can you tell us a bit about your company?
So ConsensioHealth is a physician-owned company. We are emergency physicians in Southeast Wisconsin. And we actually were a client of a medical billing company that we worked for many years. They're doing a great job at what they were doing, but we've noticed over the years that some of the most fundamental questions that we needed to run our practice, they had difficult time providing. We'd come up with open-ended questions as to why a certain distribution of charges looks like this and not what we would expect. And the answers back were lots of question marks, and occasionally we would get back a heap of static reports broken down by different features. And you can imagine, as the number of features increases in linear fashion, the number of reports increase exponentially. And so we used to get a stack of 1,000 papers, and it was completely not useful. At some point, we decided to purchase the company, and when we decided to do that, I wanted to take on the task of producing a product that would work better for physician executives as far as understanding what is going on with the product that they deliver, how can they improve how productive they are, how can they improve clinical quality, how can we be more efficient as far as operations in the billing company, and how we leverage data in order to accomplish all these things. So we've been operating after that purchase for the last 4 or 5 years or so, and we've been increasing, growing a product line. It's been an interesting journey so far, and we keep serving the same community that owns the company. We're physicians who run the company. Our clients are physicians, The shareholders are physicians. So it's a space where we're familiar with the audience. We know what they need. They know what we can produce, and the synergy works well.
Well, that's so awesome. To know what your people and your customers need deeply and to be able to provide that to them. So how did you end up creating something in the AI space for your company? What was the primary driver, and describe us a bit about the application and how you started developing it and deploying it. And
Right.
let's start from the need, and then we move forward to it.
So, I think I described to you one of the challenges we had when we were a client of a billing company. We were trying to investigate certain questions. We knew there's multiple features that could be affecting, multiple variables that could be affecting the particular results that we're seeing. And then the question is, okay, so how do we figure out what is going on here? How do we figure out what levers to pull to get an answer that would allow us to come up with more predictable results? So the first the first step is really not AI step, but rather than produce endless static reports by separate variables, is to have some sort of a dashboarding capability where you can do filtering and drilling down on the fly. So that's what we worked on first. And then the next step was to look for opportunities to let the machine drive some of the analysis for the results. So as an example, we have a client that has roughly 100 physicians and physician assistants, and client is interested in knowing how the productivity of these different providers changes over time. So I think the traditional approach would be to take this underlying data, maybe crunch it on a spreadsheet and look at every one of those providers, look at the time series of their productivity and try to come up with some conclusions to make sure everything's in check, that nobody's segueing outside of what you'd consider to be normal thresholds for performance. The problem with that, there's several problems. One, it's labor intensive. Second, it's boring because the vast majority of the data is going to fall within the limits of the outliers that you set. And third, we're not really designed for that stuff. Even if something interesting is hiding, is it a needle in a haystack, because your mind is not really geared to finding outliers, a lot of times they're there and you're just going to miss them. So one of the first things we did is try to leverage AI in order to find outliers. And instead of the physician executive needed to look at every one of those providers, the machine would basically select outliers and present the 5 or 6 individuals who in this particular month you need to peek at because their performance deviated either from their historical performance or from the performance of the group of choice. That's probably one of the first projects that we deployed in our company.
Okay, awesome. So that was a way to augment people looking into and asking specific questions around the data that you were able to distill and provide. So it was the data were analyzed, they were visualized for the people that wanted to look into, but then the AI was used to further drill down into some patterns that may not be completely obvious from the point of view of a human and looking into the data, correct?
Yes, I think it's a perfect example of situation in which you want to deploy AI. You have a test that's difficult, boring. You know that the machine can do a better job than the human. So I think it's the best of all worlds. Executives don't want to spend time executing the task. The machine can do a better job with them, even if they did choose to do it. So nobody really complains. No job is being displaced. The machine is not used for a test that it's not really designed for. It's not just fluff, like sticking the label AI on something that doesn't really need it or require it. To me, that fits the criteria of something that would likely be successful.
That's very awesome. Yeah, it's replacing human labor is something that we hear more and more and more, but it's like mostly clickbait for articles, because what we've been actually seeing around people applying AI is augmenting capabilities of people that they don't have the time to actually keep on doing, or releasing people from like boring, tedious jobs that they have to do. And this is mostly the reality, rather than taking away jobs that people think that they should do themselves.
I agree, and I think the jobs that are being replaced, hopefully those individuals, we have a society, we have a system in which we replace those jobs by jobs that are more interesting. To have somebody work at an extremely tedious task that a machine with narrow AI can accomplish these days, it's probably the case that they don't really enjoy what they do anyway. I think it's one of our tasks as a society to be able to take those individuals and train them to do something that the machine cannot perform now, and that's still the vast majority of things out there.
I totally agree with you, Eric. Like, we tend to be scared of the jobs replacement, but at the end of the day, the jobs that are being replaced currently are those that nobody wants to do otherwise, and so it's like freedom and the return of the productivity increase and the wealth back to society will help us like retrain all these people to get to do new things and take away this kind of slavery within quotes, like of doing tedious jobs.
Yes.
Awesome. What was one of the challenges that you had when you started trying to build AI in your company?
So I think you need to select the right kind of projects. I think, first of all, in my mind, you need to be prepared for failure. I believe in the Silicon Valley concept of failure as a launching pad to future successes. I don't think anybody really approaches the field as a beginner, even if they're executive and they use a company or an expert to actually develop the models that they need. I don't think anybody approaches the field with a true understanding a priori of what's going to work and what doesn't. So I think if somebody's open, they're willing to experiment. I think first you need to be prepared for the first few times for things not to work as well as you would have expected, and that's not necessarily a bad sign. I think once you go past that, it's really, like we talked about earlier, rather than look for projects for which you can stick a label of AI for marketing purposes, I think a better choice of projects is to look for opportunities where you really think the machine would excel. You have a data-rich environment that's not easy to parse for a human, and try to use the machine to the best possible way that you can. There's a lot of things that humans do extremely well, and to get the machine to outperform them either is currently impossible with the technology and the science of deep learning, or even if it is, the investment would be so large that from a business perspective, the ROI would not justify pursuing the project. So I think that selection process has to be there as well.
Yes, this is something that is very, very common among all the people we interview, like that half of the win is the project selection, and the criteria for that is, as you described, something that is actually of value, correct?
Mm-hmm.
Mm-hmm.
I agree.
And then when you get past this first hurdle, but you're already, you think that it makes sense, yes, this is something I need to pursue and go forward. And okay, I'm ready for failure, but my probabilities are high because it makes business sense.
Mm-hmm.
What would be the next steps of your experience from creating and deploying this AI? Like, how did it look? What were some kinks, some difficulties, some lessons learned for you, and how you dealt with them, so that other people that might try to do it will learn from your experience?
So, it's hard for me to tell. I think every executive probably has different experience with AI as far as, how far did they get their hands dirty? How much familiarity that they have with statistical learning, with the fundamental concepts. So I think the process might work out differently for different people. For me, the key is really the communication piece that I provide between the AI experts that does the development and thinks about the architecture, design of the network, the hypertuning, and so forth, and the goals of the project from the perspective of the client, and trying to facilitate communication between both ends that's going to cross-fertilize, where the developer gets domain knowledge that's interesting, that allows to develop a more robust model, and on the other hand, fine-tuning the product from the perspective of the end user, so that it's not a theoretical piece of work that sits, on a GitHub site and is very interesting for an academician, but it has a business purpose, and people who know nothing about AI can deploy it, and it ultimately needs to return something to shareholders as well.
So focus on the money, actually. Yes, focus on where it's increasing productivity or creating more returns for you. Yes,
I think that's key, because ultimately, if you develop projects because you're a hobbyist and you don't return results to the shareholders, either you're going to be a one-time executive, or you're going to be an executive with a one-time project.
That's very nice. So, that's correct. Yeah, I totally agree.
It's difficult to keep going. I think one of the things that open doors as far as exploring new projects is to at least be careful initially to pick projects that are going to have high likelihood of success, or if you are going to have failure, don't invest enormous amounts in them, because you have to understand you're dealing with shareholders and a board that are non-technical. And if you produced projects that eat up opportunities for the company to do business development elsewhere, sometimes it's hard to convince people that you're on the right track. So they need some positive feedback from the perspective of the projects, and that can open doors as far as other possibilities for the company.
That is very awesome, Eric, because this is something we hear again and again from all AI executives, that you need to be agile. You cannot focus on long-term, high R&D, low probability to work, but high return projects on your everyday companies. It's much, much better to start from something small, gain an edge, an advantage, get returns early, and then gain confidence of the stakeholders so they can invest more on that. And this is the way you move. And this sounds very, very familiar to the stories of startups that succeeded by starting with something small, rather than going for the big dream and nobody knows what's going to happen. This is...
Yeah, I think to bankroll the big dreams, you need the personality of somebody who's extremely persistent, and you need enormous amount of backing financially. And I think most operations don't work like that. There may be one Elon Musk in a generation that has the bankroll and the persistence, but for the best
bankroll, yes,
exactly. I think for the vast majority of us, you actually need financial backing from people who are non-technical. So you need to demonstrate exactly like you're saying, Alex, success in smaller scale projects, and then the investors understand. They'll give you more to work with.
Yes, because it's also like very good advertisement for the capabilities of the team and the company, and it's focused also on growth. They are creating growth opportunities. Awesome. So have you seen any some of the problems that you might have seen, you develop a model and then you deploy and see how it works in production? Have you seen any problems in this operations, or how did you dealt with those problems?
So, I mean, we're obviously developing a project now with your company, Alex, and the project was describing it for the audience, not for you, really. You know how it works, but the idea is to get the machine to do a better job than humans at predicting certain errors in coding of medical charts for the billing company that we have. It's a data-rich source. not entirely clear from the features, unlike data that's organic, like vision or audio. When things are disparate like that, a lot of times it's difficult for the human to see the patterns. We thought we could deploy a project that would perform better than them. And I think one of the first things we saw is when I analyzed the performance of the model versus what we saw is the theoretical performance based on the training data, is it appeared to underperform. Now, we can have a whole discussion of why things can underperform. We see it commonly because of lots of reasons. It's a failure in training. Your data is overfitted. You didn't hold back enough data for cross validation. The list goes on and on. But in this case, I don't really question the methodology. Something different has happened, which is not at all surprising. We are asking for ongoing interactions between the humans and the machine. And now the humans, not only are they getting the regular data set that they're supposed to work with in order to choose those medical charts and counters that they think would be an error, but they get an extra piece of data. Now they know that the machine highlighted it as a potential problem. So we saw a problem with this interaction. We saw that people react differently to data that's been tagged by the machine than data that didn't. Are they more vigilant? They're more apprehensive about making a mistake. We know from psychological studies that sometimes that leads to counterproductive effects. When you don't let somebody get out of the box to solve a problem, a lot of times they underperform. So I think seeing that and seeing that the model underperformed, I think an easy conclusion that is premature would have been, oh, it's not working, let's throw it away. I think instead of it, we need to understand, we need to retrain the machine on the new examples. We need to train it again to understand the interactions. And once you start in this coupling and recoupling of human interactions to machine interaction, the goal is to reach a steady state and let the machine predict on that. So I think both sides of the team, myself and your team, Alex, understand that we need multiple iterations in order to work through the problem, but we know that there's a path out. I think that's maybe a recent examples of where we saw things not necessarily perform as expected, but in my mind, that actually leveraged an approach that I think would lead to success.
That's very awesome, Eric, and thanks for mentioning that, because it's one of the things that very, very few people discuss out there. So when you develop a model, and this model needs to work in tandem with people that are doing the same job at the same time, there is an interaction which is developing, which cannot be necessarily predicted a priori by just developing the model. So when you train a model on data that people have created, and then you create you deploy this model, then the interaction between the model and the people might turn a bit, might change the dynamics of how this model would perform, or what the people even would do with the model.
Mm-hmm.
It's because some of the people tend to, if the model is okayish, then people tend to trust the model and then say, if the model says that, I will approve it.
Mm-hmm.
Or the opposite, like if some people are very against models or automation, they will say like, no, I have to second look and then maybe be a bit more suspicious. So this is an awesome thing that is happening, and it's happening in lots of places to my experience. And thank you for mentioning that. This is one of the places that you might see some different interactions of what you would expect. And the solution is to let it reach a steady state, model and people, and then retrain, as you said. And thank you so much for mentioning that.
Yeah, of course.
All right, awesome. So what do you think this is what would be one nugget of your wisdom as an AI executive? What would it be? Like if you would advise somebody to go into it?
It's an interesting question. I think it very much depends on the specific situation of the company, where they are, what do they actually do. I think where I see success always comes out of one thing, which is good communication between people that are there to solve the problem. I'm a clinician. I spend most of my time practicing in the ER. Whenever there's a problem, the underlying cause is poor communication between team members. Typically, everybody understands what needs to be done. It's not some sort of failure of knowledge typically, but of communication. And here it's the same thing. If you develop unrealistic expectation as far as what you can accomplish, or you apply the algorithms in a case where it doesn't really apply, or you reach the wrong conclusions because you're not patient enough to listen to the expert about what's going to work or what the next steps should be, or you have a set of people who are either your funders or your board members who are not behind the projects. All those things can independently, work against you. So I think the key is to communicate well and pick a project well. It sounds very non-specific, because I think the specifics have to do with the specific situation you're dealing with. But I would say experiment, hopefully on a small scale, try to learn from the results. I think try to iterate on that and find maybe subsets of the data you work with, or subsets of questions for which you can apply a model, even if not everything worked well in the beginning. I think, another nugget would be, when you recognize that you've picked the wrong projects and a human outperforms your model, and there's no reason to believe that there's any other technique out there that's going to work better, it's okay to abandon it and say, let's stick with what we have. Yeah.
So basically, be lean and start with the problem rather than AI and look for problem.
Yeah, I think if you're a hobbyist and you're interested in the subject in general, and you want to read about the technological singularity, or you want to sit out there and program your own Go deep learning, reinforcement learning algo, great, play with it, that's fine. I think most likely you're going to learn something about your projects. You're going to open your horizons about other techniques out there. But it's probably not going to lead to real world solutions for you. Ultimately, you need to apply what's out there to a specific problem. And I think most businesses have hundreds of, not thousands of problems, whether they be financial or operational. The vast majority of them right now are not really candidates for AI. Not everything is going to work well. Maybe one day we'll have AGI that's going to be able to solve all problems, and we're all going to sit on the porch in a rocking chair and smoke a cigar. I don't know, but at this point you have to be very selective. Not everything is going to work well.
All right, can't wait for that day. So this is very exciting also, because you live in both worlds, both AI and medicine. And what do you think is the future of AI in medical applications?
Yeah, I think that's a great question. So I think this is just beginning. I think there are enormous opportunities there as far as applying AI to clinical applications. I'm actually quite surprised that it's taking that long to have things out in the marketplace. It's possible that the medical industry is not really nimble. Everything's expensive, needs to go through multiple regulatory cycles, and they're hard to apply. So I think from the perspective of what I do, again, we collect a lot of information from the patient in very short amount of time. You're talking about things like past visits, past history. There's potentially hundreds of or thousands of pages of text. You need to be very selective about what you're going to read for an interaction that is going to last maybe 20 minutes. We see 2.5 patients an hour. You need to collect information from the patient themselves, from family, from physical examination findings, from all kinds of sensors that collect physiologic data on the patient. And then you need to take this whole slew of information and develop both a diagnostic and a treatment plan that's appropriate for the patient. The fact that we do it, okay, that's great. It takes a long time to develop both the domain knowledge to apply all this information and then refine it over years to become efficient. But if you ask me, based on what I know about AI so far and what I know about my job, the likelihood that we are anywhere close to the theoretical maximal efficiency is we're not even 5% there. Basically, if you had somebody or some entity that's extremely intelligent and can take all this information, the likelihood they'll come up with a better plan that's going to result in a better outcome for the patient is likely there, I would say, in the majority of the cases. I can't tell you if it's 60% or 90%, but the majority of patients would do better if we are able to deploy algorithms that would synthesize all this information and help us come up with a plan. Now, again, we're talking about something that's extremely feature-rich. The amount of training data needs to be very large. Worldwide, we suffer from a problem where we don't collect the same data points in the same way. The schemas are different. So it's hard to map all of them into a single data set that you could use. But that's sort of the holy grail is take all this information and improve the clinical outcomes for the patients. As far as smaller projects out there, I mean, there's things that you can do even with cardiac monitors that I'm sure somebody out there is working on. You have patients who are sitting in the ER. We collect data for hours on hours on tens of thousands of patients, and some of them end up having a cardiac event at some future time, or dysrhythmia, or some sort of a status change. I think to deploy a model that would take all this training data, all this time series data, and come up with decent prediction of when the patient will have an adverse outcome on the monitor, it seems very doable now. It's fairly narrow, the data is there, the outcomes are well defined. I'd be shocked if nobody's doing that now. And you can imagine a scenario, you have a patient sitting in the ER complaining of palpitations, chest pain, and the machine beeps. It says, the likelihood of a patient developing ventricular tachycardia in the next 5 minutes is 90%. Okay, I can do something now. I can prevent an adverse event. That would be phenomenal. That's doable today. I think I can come up with examples on and on and on of how can we deploy data we currently have to improve outcomes.
Mm-hmm. That's awesome. So when do you think this will happen? Make a bet, give a timeline for this.
I think the project like the last one I described, I would bet that in the next 2 years we'll see something that does this. We already have some AI algorithm that work on 12 lead EKGs. It's just a 5-second snapshot. But the idea of having this evolution in rhythm over time, looking over minutes and hours, I'd be surprised if we don't see something in the next 2 years. I think that, the sort of big project that I was discussing earlier requires building blocks that we seem to not yet have. I mean, we have deep learning algorithms. They can do really beautiful things when you feed them a lot of data. They manage to find, optimize for loss functions, no matter what the underlying complexity is. As long as you give them enough data, they don't have any issues with fitting, they'll find some sort of solution for them. But what we're lacking is a system in which the machine is able to invent abstractions and use those abstractions to deploy higher and higher levels of hierarchy of understanding. Everything seems to be embedded in the nodes in ways we don't completely understand. We can't really take an architecture that we've trained on a data set, change it, and then expect to be able to understand from the first set of nodes how they should be mapping to a different set of nodes when the architecture changes. We have no clue how to do that. We're going to need to fill up a lot of gaps until we get to a point where you as a patient will be able to have a conversation with a machine about your condition and your history, and have that machine manage you in a way that's better than a human can now. And when that happens, that machine will be able to do probably almost everything else. You probably would let it run your life, maybe with the exception of maybe it's not going to be the president of your country, but short of that, you might let it do everything. I don't think it's entirely clear how we get from here to there. I know it's something that a lot of people are interested in, big companies, small companies, academia, watching the progress of the papers that are coming out, the conferences, people trying to attack these problems, I find very interesting. I think when you ask experts what the time frame of this, you get on the one extreme somebody like Ray Kurzweil, who predicted general artificial intelligence in 2029, right? That's coming pretty fast. You probably have other people saying hundreds of years or never. Yeah, I think one thing that I think is interesting is we always assume that when somebody has domain knowledge about a particular domain, that they also are the best person to predict what is the trajectory of development of that domain. But I think what happens is, because we are designed the way we are, the best we can do is we can assess the progress that's been recent, and we can draw a tangent from there, a straight line. But technological advances don't happen like that. They stack one on top of another, and the progress is always exponential. And unless somebody makes it a mission to do futurism, to do predictions as far as technological progress and take this exponential growth into account, you're always going to find domain experts that underestimate the progress in their field. That's my opinion.
So, as an expert, how would you underestimate the timeline for this general doctor to be replaced? 2000,
yeah, I mean, it feels
2040, 30, where would you see that?
If I had to guess, I would guess 2040. Yeah.
2040. Right. Awesome. Thank you so much for your time.
Of course, Alex.
Dr. Adar. Can you please, because I'm sure that we are such a unicorn that many people will want to reach out and meet with you. Can you give them an avenue of how they can reach out to you?
Sure. I'll give you my email. It's ericadar@gmail.com. Email me with any questions, throw your ideas, tell me what you're thinking. You can teach me something. I learn new stuff every day. This is always exciting to me to see other people talk about this stuff and chat with people about it.
Thank you so much, Eric, and thank you for taking your time and giving us your wisdom around the AI application, AI from the trenches. This is all for today, and thank you so much for listening to us. Please reach out if you have any questions, and it would be awesome to reach out to Dr. Adar and ask him about your experience or get in touch with him. Thank you so much. Take care.
Thanks. Bye-bye.
Artificial intelligence.